my current title in renal care is Vice President. Renal care nursing is really, it's an acute care service. It was founded in 1991. My mother, Valerie Millerick, actually founded it in 91. It's acute dialysis at the bedside in the hospitals that really don't have a dialysis unit affiliated with it. So we essentially become that hospital's acute care dialysis service. They don't have to buy the machines. They don't have to find the staff or cover on call. So we basically do that for them. I've been a nurse for 13 years. I graduated from Dominican College in New York with a Bachelor's of Science in Nursing. And after that, I went to work at Westchester Medical Center on a med-surg floor because that was going to offer me my best experience at the time. Just interest will get you started. When I try to hire somebody new out of dialysis, I would really like them to have a critical care background. They have an overall better picture of the patient. And most critical care nurses come through a med-surg background. But, med-surg is, you can't say enough about that for your assessment skills. And your nursing gut comes from there, I believe. You have to be able to work kind of by yourself, and, your situations are changing by the minute. In renal care, in the acute setting, really, the office is really a call center. We coordinate things in the office. I mean, the office days are boring. I can't really even tell you anything. We laugh a lot, but, essentially in the office, you're putting out little fires because you're dealing on the administrative level. If you're a nurse outside, you would get your assignment the day before, kind of like a special agent. We call you up. You need to go to St. Anthony for Jones and Smith tomorrow. And, if there's any, the nurses can basically make their own hours. Unless the patient needs to be done early at the request of the doctor. Maybe they have another appointment after, or they have to go to surgery, or they need blood, or, depending on the acuity, they can go at any time. And then usually that two patients, consecutively will probably be about an 8 or 9 hour day. Each treatment runs about 3 to 4 hours on average. So, two patients will take you 7 to 8 hours to dialyze, plus setup and breakdown, and then that's it. You need to essentially be friendly and unafraid to, assert yourself without being, nudgy. You have to walk the fine line because you're the guest in the hospital. So you have to, be the guest, but feel like you're part of the family. My mother was in the business, and, I was working in a bunch of different jobs. So I figured, hey, let me give the nursing thing. It's good for your brain. It's a good umbrella career, where you can have that nursing degree and then find your niche underneath there. The entrepreneur thing, you have to just be prepared to work. Some days you're working really hard, and some days you're not. To me, the perks far outweigh the minuses, but you're not going to work harder for anybody other than yourself. And you're essentially always working because something's always happening with some kind of thought or some kind of phone call or some kind of thing is always going on with the business. It's a 24-hour service as well, so. You need ideas to go into entrepreneurship, right? And then you have to have the commitment to kind of see them through, and be prepared for setbacks. There's a lot of setbacks, like I say this all the time, nobody gets rejected by more women on a daily basis than I do, just because of the nature of my profession. Entrepreneur, like I said, you have to kind of be assertive, and you have to be kind of strong-willed. Some people call that stubborn. But, some people want to do things their way. And if you have an idea, and, don't be afraid to go for it, really, that's really what it comes down to, If you don't go for it, you're never going to be an entrepreneur. You find a lot about yourself. You're going to make a million mistakes. I can't say you need this, you need that. You need the idea and you need the commitment to see it through is really, I guess, the skill set that you would need. The male nurse thing, it's just funny. You can never shake that, like, a male doctor. We don't even call them male doctors. We call them doctors, but we call them female doctors, if you notice that. She's a female doctor, not just a doctor. I'm just a nurse, but I'm a male nurse, you know what I mean? So as a male nurse, there are certain things that, women issues that come up, I don't have a problem. Hey, a lot of younger women wouldn't want a younger man as their nurse. But for me, sometimes I can't connect that. They'll go to a younger doctor, but they can't have a younger nurse, which is all right. And that's everybody's preference. So those are some of the obstacles you run into on the floors in med-surg. I essentially don't run into that in renal care. For men, it's a little bit more different because it's perceived as a woman's profession. And, there's still some stigma attached to being a male nurse, quote unquote. Especially with the younger female population, they don't really want to have a male nurse. So you have to learn how to not take that personally and still give the best care that you can. Men entering the profession, helps bring the salaries up. A lot of firemen and cops come into nursing because they're retired at 40, so they start to go to nursing school at the end of their career, and they come in and, they're used to working 3 hours, what's 3 12s a week to them? It's part-time. So you're getting more of those, you're getting more of the manly men, I'd say. The blue-collar guys coming in at the end of their 20 years of their job, they come in and do nursing. It's a nice gig. They get paid well. I guess what I wish somebody had told me about the nursing profession at the beginning is how difficult it could be, because there's a lot of, it's a shock to the system. If you're, people think, the nurse is like what's played on ER or on TV, and they don't really see the nitty-gritty of things, and how really sick people can be and how frightening it could be to walk into that situation. And that it doesn't have to be that they're on death's door. They could just be incontinent and you have to clean that person up. And, I don't think anybody can prepare you for things like that. I wish people would have told you that. Also, you don't know how rewarding it is until you work in the situation as well. So, people to tell you, for people to say, hey, this is a great profession, not because you can make good money and you help people, but it's extremely rewarding when you do help somebody. Patients aren't staying in the hospital so much. A lot more of our patients are more acute. We don't have a lot of the patients, that come in for a dialysis-related issue or some other related issue and stay for 2 and 3 weeks. These people are coming in, they're really acute. A lot of them are, the quote-unquote train wrecks or have multi-system failure. So you have to navigate those things, and, costs are another thing. Over the last couple of years, with the economy being what it is, you have to become more cost conscious because every facility that you're working at is becoming cost conscious. So you have to navigate those fields as well. While your costs are going up, you're trying to still maintain a business and give the hospital the best quality that you can while keeping your prices low, because everybody wants something for nothing. You know what I mean? It's really the way it goes in the medical profession. We're a small nurse-owned and operated company that's been around for 18.5 years. Fending off the big corporations. DaVita is a big acute care company and dialysis company, and Fresenius as well. We kind of operate in between those people and the community hospitals where they think it's small potatoes. So we add up a bunch of those meals together, and it makes for a nice business. But the future of nurses practicing in this area, this is a great area of nursing to be in. If you're an idealist and you like to work semi-autonomously and you're not afraid to use the phone as your resource, it's a great job. You meet families, so you can really help in the transition from the acute phase to the chronic phase if that's where they're going. Or you can really help the family cope through an acute phase in the hospital because you're there a lot. So you get to really be a nurse rather than just, a glorified maid and runner.